We're a group of OB anesthesiologists and CRNAs. We provide care at 2 birthing hospitals in Louisville, Kentucky, and they're the biggest birthing centers. When I first saw Accuro, I was basically looking for something that I could carry in my hand, something that helped me do the procedure in a better way without necessarily prolonging the time that it took to do the epidural, because we can't spend 45 minutes on doing an epidural. So I needed something that I can do a quick scan and then get on and finish the epidural. Most helpful is, I believe, obviously the more challenging anatomy, bigger BMIs, scoliosis, or even patients that may not have any of those things, but you can't really feel the way their anatomy is, you can't really feel the landmarks as much. And so instead of digging my hand repeatedly into their back to push and find the landmarks, I just find it easier and more compassionate for the mom to just put the Accuro on and find my landmarks. The patients really feel like you're taking an extra step in the comfort of doing the procedure. And the concrete example was that the patient had had a previous difficulty with the spinal twice before, and when I had done her preoperative evaluation, I had told her we could use this ultrasound. The way it turned out, she came in on a day that I wasn't on call, and they just went ahead and tried doing the spinal. Well, as it turned out, it was a difficult spinal to begin with, so they had trouble getting the spinal. And the patient actually told them that, hey, Dr. Shah had told me that you were going to use an ultrasound. Why aren't you using an ultrasound? Bottom line, the attending went and got the Accuro, looked at her, put it on, got the spinal, and so the patient sort of felt vindicated by that. Absolutely, I have recommended it to all my practice mates, and my usual talking point for the Accuro is just that it's convenient. It takes hardly any time for a pre-procedure scan, and you get some hard data to back you up in terms of, okay, this is the right spot to get in. Knowing how much traditional big ultrasound machines are, it may be easier for the decision makers to make the leap to get an Accuro. It's easier to carry around and move, and you don't have to drag the whole ultrasound away. Oh, I just love it. I use it frequently, and I think that's about it.